this is Gabrielle Anderson. Today I would like to teach you how to assess for Bartonella and Lyme disease in your pediatric intakes. This is part one of a part two series. The second part, we will be discussing how to look for Babesia as well as Pandus, which comes from strep. Stay tuned. Those are infections that are all carried by ticks, and they can absolutely affect your mental health. So I'm going to walk you through an intake, if I were doing an intake with a child or an adolescent, with their parents, and some of the things that would be red flags for me that might make me want to encourage them to go get an assessment for infection. So when we're talking about school behavior, some of the things I want to know is, how is this child's brain functioning? A lot of times the brain will show up in psychological testing as having some high areas, maybe above average areas, and then really significantly low deficit, and then come back up and have something high, and then a really low deficit. And when you see incredibly big deficits, it needs to be a red flag for, ooh, is something impacting the brain? I ask questions about math because some of the, especially the young kiddos, math facts might be hard to maintain, like the short-term memory effects. Reading, remembering, this is with older kids too, and adults, like remembering what you're reading, being able to absorb what you're reading. Fine motor skills, a lot of kids, their handwriting is dreadful. If I hear these kinds of things, I start to go, I need to see if there's any more evidence that comes in to suggest that infection might be playing a role with this. Brain fog can show up, especially with older folks. Even an ADHD kind of feel can show up. Executive functioning skills being really affected. That means the administrative part of our brain becomes affected. So starting a task, staying on the task, knowing when to stop the task, incredibly messy backpacks in bedrooms, just scattered and disorganized. These could be red flags for something impacting the brain. What usually brings our clients to us, though, are emotional difficulties. So some of the red flags for me are kids who can't go to school. They're so nervous, they're so anxious. I can't do it, Mom, I can't do it. It's the child who has to have administrators come out to the van to bring them into school. It's the kiddos who are worried about the weather. They're so fixated on scary things. The world might end, or sometimes these kids are suicidal and you don't even know why they're suicidal. There's not a trauma to point to. There's not a lot of dysfunction to point to that might suggest why a little tiny kid might talk about death. Worry thoughts. Sometimes these kids are too afraid of movie content because it's like they lack a filter. So sometimes the information that we are seeing or we are sensing or experiencing by watching a movie can be so much more for some of these kids. When I start hearing some intense symptoms and we don't have a history as to why there wasn't a really significant divorce, or there wasn't some sort of trauma that they're working through, some kind of abuse that they're working through, it begins to make you start wondering, why are these thoughts in there? Why are these emotions in there? A lot of the times the kids I see who have infection, especially the little ones, we're talking like elementary school little, they almost always hallucinate, but they don't often talk to parents about it. So when I get a little kid in my office, I will oftentimes say, do your eyes and ears ever play tricks on you? And so then they might talk about, like, well, sometimes I'll see a centipede in the bathroom, but there's not really a centipede in the bathroom, or I saw this huge blah, 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 and then they start to talk about it. But sometimes kids don't know to talk about it because think about it, they're living in their imaginary world so often. When kids begin to hear things, I've had a lot of kids say, I keep hearing my name being called, or sometimes it's friendly things they hear, sometimes it's very scary things they hear. I've had a lot of kids with infection be quite paranoid. So, you're saying to me, Gabrielle, some of these are just the main mental health symptoms that kids would come in with anyway. Why on earth would you? I would be suggesting that everyone had infection if I thought this way. Well, I also ask physical questions in my intake. I'll just say, has there ever been physical complaints, even if they come and go? And I say even if they come and go because infection has a way of hiding itself. And so if it's in a state of hibernating, if it's phasing out and it's hibernating and hiding, you're not going to mount antibodies for it. And so you're not going to get a positive screening for it, but you're also not going to have a lot of the discomfort that you would have when you're in an active flare-up. So I like to know if things come and go. Headaches make me go, that could be Bartonella. Do they have any other Bartonella symptoms? Bottoms of the feet sometimes hurt with Bartonella. Sometimes, and again, guys, your genetic coding has a lot to do with how some of these symptoms present. So you can have Bartonella and you can get pink and purplish looking strange stretch marks in the armpit area, in the bottom, in the thigh area, on the tummy. Not the white ones, not regular stretch marks, but they're kind of a different color. That would suggest, you might need to go get an assessment for Bartonella, because sometimes I had Bartonella, but I never developed those. My daughter has the genetic coding for the stretch marks as well as my husband. People with Bartonella tend to be edgier than they should be, or even downright rageful. Some of especially the little ones who do not have that emotional regulation, the rages are tremendous. Sometimes they last for a really long time. Sometimes they need to be held by their parents, and just because they're flailing, they're kicking, and it doesn't stop. It just keeps escalating, and parents feel so helpless. I ask a lot about blood sugar in my intakes, especially kids who are fragile or who have a lot of rage, because sometimes these little kids have a difficult time regulating their blood sugar. And what that looks like is if there's too many carbs, you just wait. In an hour, you're probably going to see some rage, or you're probably going to see some tears that are so big, the emotional expression is so large that it's confusing. Like, why are you crying about this? Like, why are you getting so mad? So being able to be mindful, if it's a blood sugar thing, then it's the protein that brings it back to stability. So it's sausage, right, mixed with the pancakes, or it's peanut butter on top of the pancakes, right? It's something that's going to help balance it, because it keeps the kiddos level. So these are things that I start to wonder about, right? You're talking rage, and maybe a psychiatrist or another therapist diagnosed you with oppositional defiance. But I kind of wonder if it's your body's way of saying, like, something inside of me is not okay. Something inside of me is desperately wrong. Please help me understand it. I ask about tummy aches. If there's a pattern to the tummy aches, don't let the parents guide you into saying, it's a nervous tummy for school, or it might be. It absolutely might be. But hear things that parents say and the filter that they say it with, and then just allow it to create more curiosity for you, right? Could it be a reaction to some food they're eating? Could it be a reaction to some gluten maybe? Are they getting sleepy after they eat a meal? Fatigue is something that I ask about, though. When I'm looking at some of these, I want to ask about their energy level, because not always, but sometimes these kids look like they're lazy, you know? And they look like they're just too needy. Could there be some autoimmune things going on? Because it's really important to know what is creating the problem. I want to know about bedtime. I want to know if it's easy or if it's really difficult, because a lot of people who have Lyme disease have insomnia. And what that looks like in the little ones is they just can't go to sleep. They're up in their room for like an hour and they just can't go to sleep. But I also want to know, once they're settling down, once their body is beginning to settle down, do they have physical complaints? Because some kids have pains in their legs when they're falling asleep. And again, it could come and go. They could talk about them, and then those pains disappear for a couple of months, and then they come back. Parents usually call those growing pains, but again, I take growing pains and I put it on the shelf. I had one physician who's a Lyme literate physician say, I don't really even believe in growing pains. I mean, unless you're like shooting up, like, I don't even believe in them, right? So being able to think about, some people get restless leg, where it feels like there's bugs in the legs, like little worms in your legs, right? And they're so jittery. What happens at bedtime? Okay, because some of these little guys are having really bad dreams. The filter of their little mind is missing. So it's warping some of the content going on in the world. It's making it a lot scarier. It's making them lose the filter to some of their senses, so their clothes are irritating to them, or stop it, it's too loud, or some little ones have to wear sunglasses because if the sun is too much, right? The filter is missing. Energetically, I find that a lot of people who have infection are way more sensitive to other people's emotions, other people's anxieties. They might feel it more. They might be way more susceptible to like a really chaotic lunchroom or restaurant because they can't filter it out. So sometimes, because you can't filter out a lot, and I'm sure there's other reasons why too, some of these kids have a lot of bad dreams. And some of these kiddos need to sleep with mom and dad. They're terrified. I mean, it's normal for somebody with a really active imagination to be afraid at night. I mean, that's just part of being a kid. But sometimes it feels really, really scary. And when things feel like they're really overwhelming and really, really scary, I might really look at, could this be the mind and the brain's way of trying to get our attention, trying to get us to understand and take notice? But one of the things I want you to hear from today is that if you're looking at a client and you're doing an intake and you say, I mean, some of that fits, yeah, it's not going to all fit. Genetic coding, how bad your immune system is this a pretty fresh infection? Has it had years and years and years to build? There's a lot of things that factor in. There's a million things that we can learn now if we stay in the know and we allow ourselves to learn, and we feel the need to educate others. We feel the need to say, you know, psychiatrist friend of mine, have you thought about pandas? Have you thought about Lyme? Because this sounds like it might be pretty consistent. Therapist friend of mine who sees children, have you thought to check for Lyme disease? I think I want to read up on more information so that I really fully understand that. This isn't the end, though. I have another video in this series where we look at pandas and we look at babesia, more infections that can impact our mental